Hello, my name is Dejon Culpepper with the Balanced Hand Massage and Body Works here in Vancouver, Washington. Today we are going to be doing a lower leg treatment. I'm going to be performing that on myself using Smart Tools, maker of IASTM tools, which is instrument assisted soft tissue manipulation. I'm going to be using these two pretty ones right here, the Captain Hook and the Shark, to assist in our treatment today. So like I was saying, we're going to be using the Captain Hook and the Shark today. The Captain Hook I told you a little bit about in one of my previous videos. This is one of the tools that I like. It's actually one of the popular tools with Smart Tools. In particular, it's got two concave edges. One side is a single bevel. As you can see, it has one flat side, one rounded side. The other side is a double bevel, which just gives you a little versatility, being able to go in both directions without having to change hands. You can get more acute treatments with the single beveled edge. It's small, lightweight, fits into your hand pretty easy, and it's a very versatile tool, especially when you are using smaller areas like the forearms, the hands, the feet, where you're working on. We're also going to be using the Shark. And what's cool about the Shark, it is probably one of the most versatile tools that Smart Tools has created. It has fine points, so you can do some point therapy. Has a medium concave edge, so you can get into areas where you need to be able to do more rounded movements. Also has a rounded edge. It's double beveled all the way around. So you do have that good versatility of movement, several points that you can use. And it's also a smaller tool, lightweight, fits into the hand, and you can flip it around, do many different things with it. So I'm going to be using these two tools. Let's go ahead and let's get to that treatment. So I'm going to elevate the foot on a yoga block, test the range of motion of the ankle. You can see how the muscles are moving through there just by looking at what's flexing, what's actually firing. So I'm going to use a little bit of the Smart Tools provided cream just to make sure the skin isn't too dry once we do go into using the tool. I'm just using a little bit of an applicator there, so we'll get that on there. It just helps so far as the tool's actually gliding on the skin and not getting stuck or scraping the skin. So we're going to be starting the treatment off using the Shark, and I'll be starting at the bottom. And one thing that you will see as a common theme in my treatments is that I do go through full strokes, then shorter strokes, and range of motion. So flexing the calf, going up, going all the way down. Like I said, I'm using a yoga block underneath my foot just so I can get that good range and be able to go through everything that the ankle needs. So I can get the peroneals, which I'm running through right now, to actually go through their full range of motion, flexing that ankle. So a little bit of a retest, finding the sticky spots. And I highlighted it previously. My strokes used when treating myself are a few more than what the recommended amount is when you take these courses. But this is based on the fact that I'm treating myself, so I can tell if I'm doing too much pressure, if I'm not doing enough, and what tissue's being affected. So we're moving over to the inner parts of the gastroc and the soleus and finding that spot where they kind of stick to each other, trying to separate that a little bit, and still using the concave side of the Shark to go through, using the edge a little bit on the very front. You'll see, like I said before, some long strokes, few short strokes, a little bit of cross fiber with that. So we're switching over now. We're going to go into using the Shark, start at the foot. And one thing I did highlight in my previous video is that the fascia runs basically from the top of your head all the way down to your toe. So we don't limit our treatment to the specific area that we're trying to get the biggest effect on. So you will see me going down into the foot on the other side of the ankle, because that's where we are finding the restriction, or where I'm finding the restriction. Getting right there around a major landmark, which is the ankle, or the medial malleolus. So going right back down into the front of the shin. And did talk about the concave side of the captain hook and the double beveled edge, and it just gives you that ability to do a very light movement. It's not such an acute pressure. You see, we go back through the range of motion again, and you can see the difference. You can see the change in the striation of the muscle just because we've loosened that fascia up in that treatment. So we're going to go back in. You won't necessarily see what I'm doing behind, but you will get the idea. You'll see the tool peak a little bit. But we're going to get down into the lower rear area, which is more in the soleus than the gastroc. And in my previous video using the captain hook in a forearm treatment, one thing I was saying the advantage of the captain hook was that concave edge is great for getting into those lower parts of the joint, for instance, in the forearm. The soleus right now, since we're doing the lower leg treatment, just shows how that captain hook really lets you get in there and get that tissue moving, break up anything that's going on in there. There's anywhere between 15, 20 different muscles running in that lower leg when you get into each individual strand, and they will stick together. That's what fascia does. It kind of binds things. So we can have an effect on the fascia just by doing this direct pressure treatment and using these tools, and that's the whole basis behind them. So you'll catch this being used a lot in many different PT clinics, chiropractors, and as of more recently, a lot more massage therapists like myself are using these tools just to help with treatment, because there are so many different ways to help our clients get more of an instant relief and better range of motion and just shorter treatments. So it just benefits everyone. So we'll see, we go down here into the sole of the foot. That's always a major factor. A lot of people do suffer from plantar fasciitis, and that is because the fascia of the plantar tends to get tight. It's one of the areas that gets neglected a lot. So we're going to go in there using that captain hook once again, starting right there in the arch of the foot, going up on the top of the foot, using that edge to get right in there, and coming back across that ankle again. So we'll go the back side, the outer parts of the foot. What a lot of folks don't necessarily know is when you are looking at the foot, you do have muscles that come around into the plantar and wrap all the way up into the soleus. So they come down as a strap, so to say, that comes around there. So that area can be affected. You pay attention to the bottom of people's shoes and you'll see one side's worn more than the other, and that is indicative of them having an imbalance that causes them to walk a certain way. So once again, we're testing, seeing what we feel in there. You can see the difference in the range of motion from when we began. I'm going to grab the shark and go through a couple more little sticky spots that I find in there. And of course, this is going to be a little bit different. Like I said, when I'm treating myself, I can find things because I can feel things. So it is a little more aggressive when doing it on myself. When I'm working on clients, the treatment does not necessarily last as long. I do also use my hands because I'm a massage therapist. This treatment that I'm doing is strictly with the smart tools. You'll see me finish off just a little bit with my hands towards the end. But this is a strictly smart tools or IASTM treatment, which is not something that's pretty standard in my practice, but they are used to assist with the work that I do manually just using my hands. So a couple of more cross fiber strokes. Getting right in there, trying to separate those peroneals up at the top where that front area gastroc comes in, soleus. We'll go through, check their range again. You can see the difference in there. Separation's been created just through that fascia, getting a few more spots on the back side or the medial side. And even though it looks like I'm stroking super hard or scraping hard. That's not really the case. Special effects. It's all special effects. But we're going to go in, check one more time, rub through, use the hands to kind of create that, get a little more blood flushing through there. Kind of soften the tissue a little. Couple more tests. You can see the difference in the range of motion, the striations, the movement of the tissue all around. And here you go. That's our treatment. Thanks for checking us out.